Welcome back. I'm very pleased to have with me today Liam Hughes, who is the acting manager for the Lethbridge Recovery Centre with Addiction and Mental Health, Alberta Health Services. Liam, welcome.
Thank you, Sherry. It's a pleasure to be here.
Thank you. So let's just jump in and tell us all about the Lethbridge Recovery Centre.
Thank you. So we're an 8-bed community program that's located at the Chinook Regional Hospital. We provide medically supported detoxification services to people who require medical support to detoxify from their substance of choice. The goal of the program is to safely detoxify a person over a period of 6 to 10 days, and during that time connect them with supports, resources that they can use to live a healthier, substance-free and lower-risk lifestyle following discharge.
Okay. You mentioned medically supported detox. What is the difference between medically supported detoxification and intox, is another term I've heard, or safe sobering?
Thank you. It's a great question. Medically supported detox, we provide medically trained staff to monitor and support an individual through a potentially harmful episode of voluntary abstinence from substance. On the other hand, an intox or safe sobering is a modern version of historical wet mats, and this would be a safe place for a person to be under the influence of substance. It's also less emphasis on full detoxification or sobriety in a place like that, and potentially fewer conversations about the recovery journey.
Okay, just to clarify, I know you use some terms that might not be familiar to all of our audience. When you say voluntary, like medically supported versus voluntary, do I understand correctly that when someone might just decide to come off a substance themselves, they may be able to do it more safely with medical support? Is that sort of the gist of it?
Yeah, that's absolutely right. So depending on the substance, a person may require more or less medical support to safely manage during that period of detoxification. And certainly it is a voluntary program. That's right.
Okay, thank you. So what kind of medical support then do you provide in this kind of scenario?
Sure. Our clinical team includes physicians, nurses, addiction counselors, and social workers. Generally, while in the recovery center, a person would receive medication as well as intravenous fluids to manage the symptoms of withdrawal, but also keep them safe during this time. The focus certainly is to detoxify, to focus on the substance of choice, but we do provide additional medical support while a person is in the center, and as well as have the ability to connect a person to ongoing medical care as appropriate for the person. We recognize that a person that is detoxifying often has unmet medical needs that potentially need to be addressed while they're at the center.
Okay, that's wonderful. What about opiates? What, if anything, is the Lethbridge Recovery Centre doing to help manage the opiate crisis that we hear so much about?
Thank you. It's a very good question. So in addition to being actively involved with our partner organizations to provide a seamless continuum of treatment for people with opiate use disorder, we are currently working hard to support opiate use at the center by being able to provide Suboxone initiation at the center. So for Suboxone, that is a medication that is used to reduce cravings of a person who uses opiates, as well as to reduce the chances of an overdose if they do use opiates after leaving. At this time, we are providing take-home naloxone kits and training to every person who comes through the program. This is a medication that's used to reduce the risk of a death by overdose and to delay that overdose to allow time for emergency services to respond. So we make sure that everyone has on-hand access to that emergency medication when they leave the center. It is important, I think, for people to realize that detoxification of severe opiate use as a standalone treatment is not medically supported. The best practice literature additionally would indicate that detoxification from opiates can actually increase the risk of death by overdose as well as incidence of hepatitis. The medical recommendation would suggest that Suboxone medication is actually the first line of treatment for a person with opiate use disorder.
Okay. So I think the beds opened in late fall. How successful has the program been? How are things going?
So we've successfully detoxed over 100 individuals since we opened in November. What this means is that we've helped over 100 people safely detoxify from their substances, but also to offer opportunities to establish treatment goals and to continue on their recovery journey. And we are looking forward to continuing to serve this community.
That's wonderful. So I wonder if I could ask you one more question. If anybody is watching this and they either themselves have a problem with substance abuse or use, or they know of someone, what is the route to get into those detox beds?
Thank you. So it's a referral-based program. I would encourage anyone who's interested to come into the detox centers to speak with their support people, be that their primary care physician or if they have an addiction counselor or some kind of a support worker in the community about completing a referral form to come in. Otherwise, if you don't have access to that kind of person, you can certainly call the center to get in touch with us and we can help guide you on the right path.
Okay, and we'll put that number up on the screen for our viewers. Thank you, Liam, very, very much. Very good information.
Thank you, Sherry. It's been a pleasure.
Thank you very much for being with us.